What about now? Can you guys hear me? Yes. Okay. Okay. So we're good. You guys can hear me now. Okay. Yay. Hello, everyone. Happy Friday. If you can't hear, try toggling on your sound off and then on. There's someone here that's saying that they can't hear. There we go. Okay. Hello, everyone. Happy Friday. I'm so happy to be here with you all and that you are giving me an hour of your time to dive into hormones. So, my name is Dr. Olivia Watkins. I am a naturopathic physician practicing here in Phoenix, Arizona, and I focus primarily on women's health. So this is the first part of a 3-part webinar series that I've been working on. This first part, we're going to dive all about hormones. So female hormones, what happens when our periods start, what happens during the periods, what happens after the period, any irregularities that we may see during the cycle. And then I'm going to give you some of my treatment approaches that I use in clinical practice with some of my patients. I'm going to leave some space towards the end of the webinar so that we can go through some questions that you all may have. So if you have questions, put them into the chat box and I'll go through them and I'll try to get through as many as I can at the end. So let's dive right into this. Here we go. So this first picture here, I felt that this was really important to start with this because I personally love women. I love working with women. I love learning from women. I love providing care for women. I think that we are such phenomenal beings and we have so much wisdom within our bodies. Unfortunately, society has pushed us to believe that there's a lot of negativity around our bodies and around our cycles. So a part of my passion and a part of my goals is to start to dispel some of that negativity and instead bring education and awareness around our bodies and the cycles that we experience so that we can then empower ourselves to move forward with the healthcare that we deserve. The more that you know, the more empowered you are to move forward. All right, first things first. So this may seem a little confusing when you first look at it, but this is really important in understanding what's happening within the endocrine system. Whenever you hear the word endocrine, think about hormones. The endocrine system helps us to understand how hormones are made and then how they start to communicate with different organs that then go and do a certain function. So I'm going to turn this function on here so that I can point so that you guys can see exactly what I'm talking about. So whenever we think about the endocrine system, there's a 3-part pathway. I like to think about it as the mastermind, then grand central station, and then your final destination. So at the very top here, we see here in the brain, there's a part of the brain called the hypothalamus. This is where most of the initial hormone that then goes out to other parts of the body. This is where it all starts, in the hypothalamus. The hypothalamus releases a hormone. In this case, this is the GnRH, the gonotropic releasing hormone. That hormone goes to the pituitary, which is another part in the brain, which I like to call the grand central station. And then the grand central station is going to release 2 very important hormones that we're going to be talking about a lot within this slide set, LH and FSH. In this picture, you can see how these 2 hormones affect the testes in men and then the ovaries in women. And if you look here on the left side, we see the thyroid here, we see the adrenals, and we see a testicle. So not only do these hormones affect our reproductive organs, but this pathway is also really important for our pancreas, for our thyroid, and our adrenal cortex. This is what we mean when we say that the body is all connected. There's a lot of overlap, especially when we're talking about hormones. There's a lot of many actions that happen within this pathway. But I think it's important for you guys to know that 3-part process: hypothalamus, then pituitary, and then target organs, which is our final destination, okay? So some anatomy for you here. I love this diagram because it really shows us the important parts of a female reproductive system. So here we have the uterus here. Right here is where we start to see where the uterine lining will grow, and we'll talk about that a little bit later in the slide set. These two guys here are our ovaries. We then have our fallopian tubes here. The cervix is right here, this piece of tissue right at the entryway of the uterus. And then this canal that we see here, this is actually the vaginal canal. Okay, so this is what would be considered the vagina. Alrighty, menarche. So this is a really fancy word for basically the first period. So whenever you see this, that's what it means. It's the onset of the first menstrual period. This usually starts around ages 12 to 13, but I've seen it start as early as 10 years old. There's even records of some girls starting their periods as early as 8. Menarche can also happen a little bit later. So 16 years old, even up to 18 years old. Okay, it seems like you guys don't see my pointing. So we'll just wing it, okay? So this is menarche. This is like your very, very, very first period. I'm not going to go into what actually happens with the hormones there. I just wanted to bring this word up so that you all are familiar with it if you hear it in other spaces. Okay, so with the menstrual cycle, so many different things are happening at one time. So I'm going to break this up into 2 different parts. We're going to talk about what happens within the ovaries and the eggs, and then we're going to talk about what happens within the actual uterus and the uterine lining. So whenever you think about your menstrual cycle, put this in your brain. There are 2 phases. There's the follicular phase, which is the first phase. And then there's the luteal phase, which happens after ovulation. So when you hear the word follicular, the word follicle is in that word, which is referring to the ovarian follicles. So on this left side of this picture here, you see this very, very, very tiny follicle, okay? The whole goal of the follicle is to mature the egg. As we start to progress through that follicular phase, estrogen increases from FSH, which is one of those hormones that's released from the Grand Central Station. FSH is released, estrogen starts to increase, and that's what matures this egg. So during the follicular phase, the follicle is maturing an egg, okay? So once that egg is nice and mature, and we see it here, the body signals to the brain like, hey, this egg is mature, now we're ready to release it. So those high estrogens signals another signal to the pituitary to release LH. LH starts ovulation. Ovulation is when the actual egg is disrupted from the follicle. The egg then moves through the fallopian tube down into the uterus where it waits for implantation, okay? So ovulation is when we actually release that egg from the follicle so that it can travel. Once ovulation has happened, we move into the luteal phase. Luteal comes from the word corpus luteum. Corpus is a Latin word meaning body. So as you see in this luteal phase, you see this little yellow, weird looking thing. It looks like a round candy corn thing. This is basically a skeleton of where the follicle remains. So where we had that egg that was released, now we have a follicle here. This follicle starts to produce progesterone. This puts us into the luteal phase. And what this does is it continues to mature and secrete progesterone to ripen the uterine lining, to wait and anticipate for implantation or fertilization with the sperm, okay? During the luteal phase, this is where people start to experience PMS. This is the phase in the cycle that's right before your period, okay? So just to recap, in the follicular phase, FSH and estrogens are the stars of the show. Then we ovulate, we release that egg. The egg flows through the fallopian tube, it camps out in the uterus, and then progesterone starts to take over, and that's when it shines, okay? Once progesterone and estrogen, or once the body realizes that implantation is not going to occur, the egg has not been fertilized from sperm, both estrogen and progesterone drop drastically. And that signals to the body that we need to shed a lining, and that's when we have our period. Okay. In this next slide here, this is actually showing us what's happening in the uterus. Okay. So the menstrual cycle, like I said right before, this is when both of those hormones drop drastically and we lose that lining. Well, around day 5, do you guys see that? Do you see where this uterine lining starts to get red and plumpy and it starts to grow? That's called the proliferative phase, which is happening during the follicular phase. Okay, that's still the first part of the cycle. And if you look up at these two diagrams of the uterus, we see where that tissue starts to grow on the inside. So estrogen's causing that uterine lining to continue to grow and proliferate. We then ovulate, and then we go into the secretory phase, the luteal phase. And you see here that now the uterine lining is growing even more thick. We have more blood vessels there. The uterine lining gets a little bit darker red. This is just waiting out, again, waiting for that egg to be fertilized and then implanted in the uterus, okay? That's that second phase of the cycle. If that implantation does not happen or fertilization does not happen, both of those hormones drop. And that decline in those hormones is what initiates our period. And then we start it all over again. So our period is actually the end and the beginning of the cycle, if you think about it that way. And then we go into that follicular phase, ovulation, luteal phase. And then we just continue to do that with every cycle that we have. So this photo here shows us all of those different processes that are happening simultaneously. So at the very top, we see the ovarian follicles that we talked about in that follicular phase. So that egg is getting nice and ripe. At the same time, the uterine lining is starting to grow, okay? Then we have ovulation, and you see here, you see all these lines. There's a green line for FSH, there's a yellow line for LH. LH is that hormone that signals that ovulation is to occur. Whenever we see that spike, and you see it here, this little peak, that simulates ovulation, which puts us into that second phase. So again, we start to produce progesterone, this purple marker here, and then the uterine lining continues to grow and wait for implantation. So this is just showing us all of those things happening at one time. This is really important to understand because as you start to track your cycles, or if you have certain irregularities with your cycles, understanding what should be happening can help you to identify when things are off, and it can also help your doctor to identify what's happening when things are irregular. Okay, so abnormal versus common. I want to make a point to differentiate these two terms. I see a lot of women who have irregular cycles, who may have symptoms before the period, PMS, and those are very common conditions, which means that it happens a lot. There are a lot of women who have these experiences. However, that doesn't mean that it's normal, okay? Something can be common and can happen with a lot of people, doesn't mean that it's okay. And I bring this up because in my experience, there have been women who have irregularities within their cycle, and for them, that is their normal. That's their new normal. Either they don't have a period, or they have a period every 2 weeks, or they go months without having a period. And to them, that's their normal, but that's not medically normal. And so I like to really make that clear. This helps for patients to be more aware when things aren't normal so that they can articulate that with their doctor. So as we move forward, we're going to talk about PMS. We're going to talk about irregular cycles and different ways that that can present. We're going to talk about menorrhagia, which is another word for heavy bleeding or prolonged bleeding. And then we're going to talk about dysmenorrhea, which is the medical term for painful periods. So first things first, PMS. We see PMS depicted so much in pop culture, in movies, in TV shows, and songs, and comedy. Everyone knows this picture, the woman who is angry and hormonal with certain cravings. As much as that kind of rubs me the wrong way, depending on how it's presented, there is some truth in some of those symptoms. So this is a really nice diagram that shows us just how many parts of the body can be affected during this premenstrual phase. So how we decipher what's a premenstrual syndrome versus other symptoms is that these symptoms usually happen before the period, premenstrual. And usually once menses starts, so once the woman starts to bleed, some of these symptoms start to lighten up. Not always, but most times they do. So starting at the very top, we have mood swings, low mood, increased anxiety. A woman may feel more weepy during this time. Headaches is really common, disturbances in sleep, having some brain fog or difficulty concentrating. I see that a lot. Some women may experience certain breakouts or notice that their skin is a little more oily before their periods. Carb cravings are very, very common. And there's a lot of research that shows us a connection between craving carbs and serotonin, which is a hormone in the brain that helps us to feel better. Carbs help to increase serotonin, which is one reason why some women may have these cravings before their period. Some people have light cramps. A decreased appetite for sex is really common, and constipation or diarrhea. So I see this a lot. Premenstrual syndrome happens so often, and so often people are ignored or pushed to the side when they bring these symptoms up to their doctor. But this is a real thing, and the more that you can identify these symptoms, the better you are at tracking your periods and tracking what's happening with your cycles. A lot of women know their period is about to come because some of these symptoms pop up, and they only pop up right before the period. Okay, so again, it's just bringing more awareness to what signals is my body telling me, and how can I become more aware when I'm in this transition? How do we treat PMS? So, number one, support the liver. Now, some of you may be thinking, what does the liver have to do with PMS? Well, the liver plays a really huge role in hormonal metabolism, period, okay? This is how we metabolize many different things in the body. A lot of what we put on our mouth, what we put in our hair, what we put on our skin, the liver metabolizes that. The liver is our major organ related to detox. So that's also important for hormones. If you're not detoxifying your hormones, we can see an increase in some of those negative symptoms associated with our periods. So how do we support the liver? I love castor oil packs as a naturopath. It's very cost effective and it's easy to do. You basically apply castor oil onto the abdomen. This is before the period, not while you're bleeding. And then you get an old t-shirt or an old towel, something that you don't care about because the castor oil will definitely ruin it. And then you apply a heating pack on top of that. And I suggest that patients do this at least 3 times a week for several cycles before they start to see improvements. If you can do it every day, that's great. I typically like to do these before I start to wind down in bed. So when I have my quiet time and I drink my tea or I have my journaling or I read, I'll do a castor oil pack, and it can be really helpful in making sure that the liver stays really healthy and that you can metabolize those extra hormones, specifically estrogen. Botanical intervention. So using herbs. There's so many beautiful herbs out there that helps to keep the liver strong and healthy so that it can do its job. And also dietary modifications, which we'll talk about in this next column. So addressing the nutritional needs. Less refined sugars, so the pastries, the chocolates, the candies, simple carbs, breads, biscuits, pastas, which is my favorite, rice, even like white potatoes. Think about white foods, white flour. Those are simple carbs. Dairy, who doesn't love cheese? I love cheese, but dairy is super inflammatory and can cause a lot of these symptoms to be worse. Sodium, so a lot of packaged foods have high sodium. Those quick meals that we get at Trader Joe's that are like really easy to pop into the microwave for a few minutes, those are full of sodium and can cause your symptoms to be worse. And of course, animal fats, so beef, poultry, pork, those fats can cause the symptoms to be worse as well. Caffeinated beverages, so coffee, different type of coffee drinks, frappuccinos, lattes. Usually those have a ton of added sugars. Also, soda can be terrible for the period. So all the good stuff, right? These are things that cause inflammation in the body in general, but particularly in the phase before our period, it can cause things to be worse, and it can even affect for when menses start. And we'll talk about that a little bit later as well. Zinc, magnesium, fiber, iron, omega-3. So these are some micronutrients that have been found to really improve our symptoms that we have with PMS. And we get these micronutrients through whole foods. So leafy greens, getting a lot of fiber, flaxseed, omega-3s, so healthy fats, avocados, wild-caught fish, avocado oil, olive oil, iron, again, really leafy green vegetables. All of these foods can help to decrease some of those exogenous estrogens and help us to get the excess estrogens out and to decrease some of those symptoms before the period. Other nutritional and botanical supplementation. So B vitamins can be very, very helpful. Magnesium is incredible. Magnesium is a muscle relaxant. Talk to your doctor about what form of magnesium is best for you. There are like 7 different forms of magnesium and they all have different functions. But this can really help to decrease some of your symptoms and decrease cramps because it relaxes the muscle. The uterus is just a muscle. So magnesium helps with that. Vitamin E and calcium can be very helpful. As far as herbs, here are some herbs that I use pretty commonly in my clinical practice. Chase tree, I'm sure a lot of you have heard of that. The most famous Vitex is awesome. Vitex helps our bodies to produce more LH, which then helps produce more progesterone. The more progesterone we have, it helps to off balance this estrogen dominance pattern that we see with a lot of these female conditions. Estrogen is like one of those hormones where it just stays, man. We have a lot of it in our environment through plastics, through our makeups, through our water, certain foods that we eat. All of those have exogenous estrogens, meaning estrogens from the outside environment. So whatever estrogen is supposed to be decreasing, most times it stays really, really high. And then we don't have progesterone to like offset that balance. So we end up having estrogen dominance. Chase tree helps us to increase some of that progesterone naturally. Ginkgo is helpful. Don Quai is helpful. Black cohosh, wild yam, and licorice are some other herbs that I use. And exercise. Exercise is also important. Obviously for many different reasons, but just having that increase in circulation, keeping our metabolism really healthy, it helps us to, again, process hormones that we don't need, okay? So irregular cycle. So here are 3 different categories of how your cycles can be irregular, and we're going to dive into each of these individually. Amenorrhea means the absence of a period, so not having a period, either in a woman who has had a period consecutively, all of a sudden she goes 3 months without a period, or someone who has a history of irregular cycles, they go without a period for 6 months. That's how we diagnose amenorrhea. Polymenorrhea is having very frequent periods, so having a cycle less than every 21 days. And then Oligomenorrhea is very infrequent cycles, so when cycles are far apart, okay? So more than 35 days consecutively. So how do we count our cycle days? I get this question a lot, and this is really important when you start to track your periods, which I recommend that every woman that still has a cycle, this is really important for you to, one, know what your cycles are like, And then again, so that you can really be articulate and be able to explain to your doctor what your findings are with your own period, okay? The day that your period starts. So on this calendar here, I have that first red dot on the 16th. That is cycle day 1. The day that your period starts is cycle day 1. The 17th, cycle day 2. The 18th, cycle day 3. The 19th, cycle day 4. This is how we count your periods. There are a ton of different apps that are free, that are really helpful in helping you to track your cycles. I personally like the Clue app, but there are several that you can use. Okay, just remember that the first day that you bleed is cycle day 1. So let's dive into amenorrhea. So the absence of a period for 3 or more months in a woman with monthly periods, or 6 months without a period in a woman with irregular periods. So I've broken this down into 5 major classifications. These are 5 different categories that can cause a woman to have an absent period. So number 1, disorders of the vagina or the uterus. So this is either an anatomic issue, so the actual tissue in the vagina or the uterus, something's wrong there, or there's some genetic abnormalities that have caused those tissues to be abnormal. Number 2, disorders of the ovaries. So the ovaries can be non-responsive to pituitary hormones and other hormones. We call that ovarian insufficiency or ovarian failure. Or PCOS. PCOS is a very common condition that affects the ovaries, and we'll definitely talk about that in just a few minutes. Disorders of the pituitary gland. Remember, the pituitary gland is our grand central station. This is the gland in the brain that says, hey, I have hormones, and I'm going to send them out to the ovaries, the thyroid, the pancreas, the adrenals. If there are disorders with that pituitary gland, we don't send the signals to those target organs to do their function, okay? So some things that we see, imbalances in LH and FSH, which are those 2 hormones that we talked about earlier. TSH, which is a thyroid hormone. I see a lot of thyroid issues related and connected to period issues. Again, this is how the body's all connected. And then a prolactinoma, which is a tumor, it can be a benign tumor in the pituitary gland. And this can also cause your periods to be absent. So these are some labs that we use to help decide and diagnose irregularities with menstrual cycles. Disorders of the nervous system. So the hypothalamus, which was that mastermind, that very, very first stop in the brain. Issues with that part of the brain can cause an absent period because then it can't send a message to the grand central station, right? Also stress. Stress is a huge factor, and I know some of you have experienced this. Either your periods just disappear with stress, or sometimes they even come more often with stress. But stress is one of those things where I know patients may get tired of their doctor saying, like, it's stress, it's stress. It's one of those things that we can't actually put our hands on, but we all feel it and we all know it when we're under stress. Our body definitely responds when we're under that burden. And the last one is just some miscellaneous causes that can cause amenorrhea. Pregnancy is the number 1 cause of the absence of a period, go figure. Excessive exercise and low body fat. So some of our extreme female athletes, we start to see that they don't have a period because they have low body fat, which is really important for the body to have a cycle. If you don't have the body fat or you're under excessive exercise, the brain and the body deciphers that as just a stressor, right? Like our bodies can't really differentiate between a physical stress, a mental, emotional stress. It just sees all stress as the same. So this excessive exercise and the low body fat to the body, that's just saying there's a stressor there. This person isn't in the space to procreate, okay? So that's another thing that we see with some of our athletes. Eating disorders or restrictive eating, this can cause amenorrhea. We need cholesterol to make hormones. So if we have a patient who isn't getting those macros or even their micronutrients in their diet, if they don't have what they need to make hormone, they're not going to have the processes that hormones stimulate, okay? Certain medications can cause periods to be absent, substance abuse, so certain drugs and alcohol abuse, again, that's another stressor to the body. Chronic illness, and of course, contraceptives, so birth control can cause the absence of a period. I hope all of that made sense. Okay, so PCOS. Let's talk about PCOS. There's a lot of buzz around PCOS. I've been seeing it a lot lately, and I'm really happy for it because this is such a common syndrome that we see in clinical practice. So PCOS stands for Polycystic Ovarian Syndrome, and I'm talking about it in this portion of the webinar because this is what causes the absence of a period, okay? So you see how we have these cysts here on the ovaries on the left. That's one of the ways that we can diagnose PCOS is actual cysts. So what's happening is the body is trying to ovulate, is trying to release that egg, but we have certain imbalances within the hormones that inhibit that from happening. So instead of us releasing the eggs, we now have these cysts, and it just continues to fuel that cycle, okay? One of the ways that we diagnose, so irregular periods is something that I see with PCOS. High androgens, so testosterone or DHEA, are typically elevated in PCOS, and then obviously having those multiple cysts. I do want to make note that PCOS can look very, very different. There are different variants of PCOS. We can have an insulin resistance PCOS, so someone where their labs are starting to show us that they're in this pre-diabetic phase. That can be a variant. Oftentimes there's obesity that's associated with this, hypertension that's also associated, environmental stress. There can be some genetic predispositions there. So PCOS isn't the same for every patient. Okay, it's not a one size fit all. And this is where getting a really good history, doing labs, and even doing imaging really helps your doctor to decipher, like, if you have PCOS, what type of PCOS are you presenting with? This next slide here is just showing, again, so much overlap with PCOS, okay? It can really affect different parts of the body. We also see excessive facial hair, cystic acne, absent periods, or periods that are far away from each other, metabolic syndrome, so obesity, hypertension, again, like we mentioned before, which then causes other things like these psychosocial issues at the bottom: body image, self-esteem, depression, anxiety. All of these things have to be taken into account when we're treating a person with PCOS because there's so many layers. And this is where naturopathic medicine really shines because we prioritize treating the whole person. We're not just treating your ovaries. We have to treat the whole body to bring balance back, especially with PCOS. Again, this is just showing some more overlap. And here are some of those symptoms that we see. So again, irregular menses, there can be pelvic pain, multiple small cysts on the ovaries, which we see through a transvaginal ultrasound, cystic acne, weight gain, heavy bleeding, headaches, infertility. Obviously, if you're not having a period, that's a sign that infertility may be affected, or fertility may be affected. Elevated blood pressure, hair growth, male pattern baldness, and decreased libido. How do we treat it? Again, treat the whole person. We have to find out what is the root cause to the PCOS. And for many people, it's multiple different things, okay? So we have to do our due diligence in getting a good history and finding out what exactly is going on with this patient. Diet is very, very important. So getting away from the standard American diet and increasing more of our whole foods, our live foods like fruits, veggies, nuts, seeds, even fish to get those healthy fats. Exercise is also important, especially for the variants where obesity, hypertension, insulin resistance, or diabetes is in the mix. Exercise is really important at treating those imbalances, which can then help us treat the PCOS. Botanical and nutritional supplementation. So here are some herbs that I like. Hormone replacement therapy and contraceptives. So progesterone can be helpful in this. A lot of conventional docs treat this with birth control as well. So risks of amenorrhea. So what are the risks of us not having a period? I want to bring this up and really stress this because sometimes our periods can be such a painful experience for us every month that we're happy when we don't get it. And I totally understand that. However, there are risks when we are not having a regular cycle. Estrogen is super important for our bones and our bone health. If you're not having that estrogen and progesterone cycle and fluctuations throughout the month, you don't get those protective benefits. So it puts you at a more of a risk for osteoporosis and bone conditions. It puts you at more of a risk for cardiovascular disease. It puts you at more of a risk for endometrial hyperplasia, which is basically an overgrowth of the uterine lining. And if you look here on the left, this picture, on the left, on the far left, is a normal uterus. That lining is nice and thin. Everything looks healthy. But then on the right, we see that hyperplasia. We see where that tissue has just started to grow. Okay, it's because we're not getting those fluctuations where the uterus grows and then we lose it. Okay. And this can lead into cancer if it's unchecked. And then, of course, infertility. So switching gears here, polymenorrhea. This is periods that happen less than 21 days. So this is a very frequent period. On the left here, we see a normal cycle, a normal 28-day cycle. And then on the right, we see where we have a frequent menses cycle. So bleeding is happening twice within this month. That's polymenorrhea. Why does polymenorrhea happen? So hormonal imbalances between estrogen and progesterone again. Uterine fibroids, polyps, cervical polyps, or ovarian cysts can cause bleeding within the cycle. Infections with the cervix or the uterus, blood disorders, hypothyroidism can cause frequent cycles, stress, contraceptives, so not using contraceptives the way that they were intended to be used, and even malignancy. So this is important, again, that if you notice that you're having 2 cycles within a month, that is not normal. Okay, so we need to make sure that we're paying attention to these things so that we can prevent more serious conditions from happening. Oligomenorrhea. So this is infrequent menses. This is a cycle that happens 35 or more days. So this little picture here is showing us that this person had a cycle 1 month and then she skipped a month and then it happened again the month after, but at the very, very end. This is an infrequent period, okay? This usually means that there's a defect in that second phase of the cycle, that luteal phase, when progesterone shines. Why does this happen? Again, you see this common theme, hormonal imbalances between the estrogen, progesterone, and prolactin. Excessive exercise or low body fat can cause this. Nutritional deficiencies, stress, and contraceptives. So you'll see that these are very common themes within these irregularities in the cycle. Okay, they're like the same girl with a different dress on. Treatment for irregular cycles. Again, address the root cause, and there could be several of those. So getting a full comprehensive history. When did periods start? Were they always irregular? How long do they last? What does your bleeding look like? If you're on birth control, what were your periods like before birth control? What are they like with birth control? We do labs to see what those hormones look like. And every once in a while, we'll do imaging to see if there's any abnormalities within the ovaries and the uterus that we can see. Herbs. I love herbs. Herbs are so gentle but powerful. Most of them have a low side effects, so I love using them. Diet, again, is very important, making sure that we're keeping inflammation down. Stress management is also very important. Stress affects the body in every way. So if we can help to manage our stressors in our life, this helps our overall health and particularly our reproductive health. And again, hormone replacement therapy or OCP, which is oral contraceptives. All right, dysmenorrhea. So dysmenorrhea is a medical term for painful periods. And I just want to note that I love this picture because I love her shoes. When I saw the picture, I was like, I need these boots. But it's really a representative to how a lot of us feel during our cycles. We have those cramps, we feel terrible. Why does this happen? So there are 2 different types of dysmenorrhea. There's primary dysmenorrhea, which is the absence of any physical abnormalities or identifiable pelvic disease. So this means that there's no abnormalities with the uterus. There's nothing wrong with the ovaries that we can see. There's nothing that we can identify that's saying like the organs are sick. Okay, that's the most common type of dysmenorrhea. And that's the type of dysmenorrhea that we're going to talk about in the slide set. Secondary dysmenorrhea is painful periods that are caused by some type of abnormality. So endometriosis, which is when the uterine lining starts to grow outside of the uterus. Pelvic inflammatory disease, adhesion. So when patients have had C-sections or certain surgeries or trauma to the area, our bodies start to produce scar tissue that can cause the organs to like stick to each other and be kind of squished up and unhappy, and that can cause pain. Ovarian cysts, polyps, or uterine fibroids. Those are all physical abnormalities that can cause the period to be painful, okay? Up to 60% of women experience painful periods, and 10% of that 60% report that the pain is so severe that it disrupts their quality of life to 1 to 3 days. Around 600 million work hours are lost every year. So I see this a lot, and I even have a personal history with dysmenorrhea. And I know how devastating this can be. Like, we dread this time of the month. It decreases our productivity. It inhibits us from reaching our goals and showing up for different people in our lives, and even showing up for ourselves. So this is something that I'm really passionate about and helping with my patients. Why does this happen? One thing, pelvic congestion. So lack of blood flow and therefore lack of oxygen to the uterus. Traditional Chinese medicine calls this a cold uterus. An increase in prostaglandin production within the uterus. So prostaglandins are types of signals that start inflammation. So our uterus goes through inflammation with our period. We're literally breaking down that tissue and then getting rid of it through our vaginal canal. That's an inflammatory process, okay? Prostaglandins cause that to happen. Whenever we have other inflammatory things within our body, like diet, we increase those prostaglandins, and that increases our pain. Hormonal imbalances. So again, having a little bit too much estrogen versus progesterone, where we start to grow a lot of that lining, and then we have to get that lining out. So our uterus starts to contract harder, which causes stronger and more painful cramps. Treatment. How do we do this? Again, reducing those inflammatory foods, dairy, beef, pork, poultry, eggs. There's a theme here. Animal products. They have a lot of prostaglandins and omega-6, which is a type of fatty acid that is pro-inflammatory. Processed sugars and trans fats, basically all the things we want to eat during our periods when we feel like crap. Maintaining healthy bowels and increasing fiber. The stool is another way that we get out exogenous and excess estrogen. So making sure that bowel movements are regular helps us to get rid of those hormones. Staying active, exercise, again, is important. Avoiding smoking, which is really inflammatory to the body. Reducing stress. Warm applications can be really helpful. So hot packs, Epsom salt baths are great. Uterine massages, vitamin E, magnesium, omega-3s, and then some herbs. Cramp bark and Jamaican dogwood are some of my favorites to use. Progesterone is also really helpful. All right, switching gears here. So menorrhagia. Menorrhagia is the medical term for abnormally heavy or prolonged bleeding. So what makes a period abnormally heavy, or how do we quantify that? So if you are experiencing over 80 milliliters in a cycle, which is the equivalent to about 16 normal absorbency pads, if you go through that many pads or you're bleeding for 7 or more days, we can consider that menorrhagia, okay? That's an abnormally heavy or long cycle. What causes heavy menstrual bleeding? So here are some really common causes. Uterine fibroids, right here at the bottom left, is super common, especially in African American women and our Latina women. We see uterine fibroids a lot, which can cause a lot of bleeding. Uterine polyps, so benign growths on the uterine tissue. Cervical cancer is another thing, endometrial cancer. PID, so pelvic inflammatory disorder. So you see, these are all things that are actually affecting the tissues of the uterus. Bleeding disorders is another thing. There are some people who have clotting disorders, so genetic abnormalities that inhibits their body from creating clots. So whenever bleeding happens, they just keep bleeding. They don't have those pathways that helps their body to produce clots to decrease the bleeding. Here's a picture of different types of fibroids. I wanted to bring this up because it is so common. I'm not going to go into this too much, but I just wanted to show you this image so that you can see that these are how fibroids can present in the uterus, okay? And this is why they can cause infertility, because you start to see that it really changes the structure of the uterus. The uterus isn't able to do what it was designed to do because of these masses. How do we treat it? So work it up. Again, identifying the root cause. Are there fibroids there? Does this person have a clotting factor disorder? Does this person have iron deficiency anemia now as a cause from the heavy bleeding, which can cause brain fog, shortness of breath, fatigue, which is really, really huge. So again, just identifying what's really happening. Astringent herbs are really great. They help to tighten up those blood vessels and constrict the blood vessels so that we're not bleeding as much. Uterine tonics help to really beefen up that uterine tissue so that it can be nice and healthy and that it won't be so easily to bleed. Progesterone also helps. Treating the liver helps, again, decreasing that exogenous or excess estrogen. If we have more estrogen, we're going to grow more lining, which means that you will lose more blood when you bleed. Contraceptives, so birth control is very popular in conventional medicine. And then our last and most invasive option is surgery. I do want to say that as a naturopath, I like to keep surgery at the very end of my list. However, when you have certain fibroids or other abnormalities within the uterus, depending on their size, sometimes surgery can be necessary. And there are different types of surgeries depending on what your condition looks like. So I think that's important, and that obviously we don't want to go there. But there are some cases that we just can't reverse with our natural modalities, okay? And then last but not least is contraceptives. So I'm not going to dive into contraceptives. I think I'm going to save that for another topic, another day. But I wanted to bring this up because contraceptives are very, 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 very common with the female population. I think that it's really important that women have the right to choose how to handle their reproductive organs and to do as they please. However, I want you all to know that if you decide to use contraceptives, there are other things that you can be doing alongside those contraceptives to protect your fertility and to protect things that you lose when you use contraceptives, particularly oral contraceptives. Oral contraceptives can decrease some of our B vitamins and some of our other micronutrients. We also see elevation in our CRP, which is an inflammation marker. And I also see elevated AM cortisol with contraceptives. AM cortisol is our stress hormone that's produced in the adrenals, right? So if you're going to be on oral contraceptives, there are things that we can do to address those elevations that happen in the background to make sure that you are as healthy and as protected as you can be while you're using them. Phew. Okay, so that was almost exactly 49 minutes, which is how long I wanted that slide set to take because I wanted to dig into some of your questions here. So let's see. I don't really see any questions so far. So I see that someone is mentioning PCOS and fibroids. Yes, it's a very, very important topic. There's a lot that we can do naturopathically to treat this. Even, like I said, when fibroids are so far gone or if they're at a certain size to where they need to be surgically removed, there are things that we can do naturopathically to set you up for a healthy recovery after that and to try to offset them coming back. Does anyone else have any questions? Any other questions? Hi. I see so many friends in this panel, which is really great. Oh, great. This is awesome. So we're going to continue to do this. Like I said, the second part of our webinar series is going to focus around fertility. and some obstacles that I've seen in my clinical practice with women who are trying to get pregnant and are having a hard time, and then my treatment approach to that. And then the third webinar series is going to talk about premenopause, menopause, and postmenopausal women and how I help them go through those transitions. Sinus migraines as a symptom. So this can happen with the different fluctuations in hormones. Excess estrogens and not enough progesterone, it definitely affects the vessels within the brain. So making sure that those hormones are balanced throughout your cycle can help with the migraines. I'd have to have a deeper conversation with you about what treatment looks like as far as treating migraines. What do you do regularly to make the entire process? I don't understand what that question means. Janine, if you can clarify, that'd be great. I do want to shout out that here at Living Wellness, I do a free 10-minute meet and greet with potential patients. This is an opportunity for you to present some of the concerns that you have, and then for me to give you my treatment approach, and for us to see that if we're a good match with each other before we move forward. You can always reach me at our website, www.livingwellnessmedicalcenter.com, or you can call and schedule that free meet and greet at 480-588-6856. Let's see. Okay, we have some more questions here. Do you use the supplement DIM? Would you recommend it? I definitely use DIM. I love DIM. DIM is, it comes from cruciferous vegetables, and it helps the body to metabolize estrogen. So yes, that is something I like to use. Very low side effects for it, and it can be very helpful. What do you think is the cause of normal cycle lengths but PMS symptoms and ovulation and right before and during periods? So again, that is the hormones that are starting to change. So cycles can be normal, which is awesome, and you can still have those PMS symptoms. That's just telling us that it's a signal that hormones are changing, right? It's right before menses, and menses is when both of those hormones, progesterone and estrogen, starts to decrease. So if we can kind of keep those hormones level to where we don't have as much estrogen, we have a little bit more progesterone in that second phase of the cycle, that can help us to decrease some of those PMS symptoms. Okay, it doesn't mean that anything's wrong with you. Yeah, migraines suck. I'm really sorry about it. What date is the menopause? So the menopausal webinar will be on November 13th. And our next one, talking about fertility, is going to be on October the 30th, okay? And they're all going to be at 3 o'clock the same time. And I'll send out those registration links. Do I have a general wellness habits that focus on healthy periods? Yes. So my general wellness tips, one is stress management, which can be very hard, especially in this time of uncertainty. Keeping a really healthy diet, making sure that if you're going to eat animal products, that's fine, but let's try to get healthy and clean animal products. So grass-fed beef is really important. Wild-caught fish is important. Staying away from those simple carbs, like white bread, white pastas, white rice, processed foods, those sweets and pastries and desserts and all those yummy things that cause inflammation. And then regular exercise, I would say, is really helpful. All right, guys. So we are nearing our hour here. It was so nice to spend this Friday with you. I totally look forward to the next 2 webinars, and I hope that I see you guys there. This will be recorded. I will share this on my personal page, and we'll share it on our Living Wellness Medical Center Facebook page so that you can watch it and you can share it with some of your friends. Happy weekend, and I'll see you next time.